I just am finishing up a work day and some really frustrating conversations, and I don't even know where to look in this camera. So sorry, this isn't the greatest video, but I wanted to get this information out there. I love my profession. I support veterinarians. I think they need more of our support. And sometimes they say things that are just really frustrating, and I think they mean well. I had a client I was talking to tell me how her vet told her she has a 17-year-old cat who's obviously in pain. According to her pet parent, her cat is definitely in pain, and the Silencia injections, that's the newest arthritis medication, they're not working. And her vet told her they're not working because her cat is so overweight and needs to lose weight. And, you know, I'm not an all or nothing, especially when it comes to medicine. You know, there is no all or nothing, right? So I can't say like this cat's not going to respond to diet and exercise, but I want you to look at it a little different way. This is a 17-year-old cat that currently doesn't have its pain managed. And we're gonna start dieting this cat, and they wanna put it on a water treadmill. I want you to think about it. If your 95-year-old mother, grandmother has really bad pain that is not being managed, no, we don't euthanize her. You know, when people are like, oh, then just euthanize me because I have bad pain. Of course not. But are you gonna diet her and put her on a treadmill? So I think we just need to get perspective sometimes. I mean, I often wonder, because cats are so cute, cats and dogs are so cute at 17 years old that we forget they're very old. Like, you would never push your 95-year-old mother or grandmother. I have to say mother because I'm so old that I would have a 95-year-old mother. You wouldn't push them on a treadmill and make them diet. My gosh, it's hard enough to deal with pain. I deal with chronic pain for, you know, I have some genetic issues and I have to deal with pain, and it is really hard. And now you're going to starve me and make me work out? I think that's a quality of life issue. And this person was so resistant because her vet said that was the answer. And so she was convinced that was the answer. And so my concern is now we're no longer really thinking about this and really considering the pet's welfare. We're just doing the answer. And I think sometimes that's the biggest problem with our veterinarians' advice, is that they are so solution oriented. That's what they study. That's what their whole goal is, to find you solutions, that sometimes in the midst of, you know, doing it with a really good heart and good intention, they can confuse the issue. I had another client today that I was at the euthanasia, and the client's daughter is a horse veterinarian. So we were sitting there chatting, and she was so upset that their vet had told them they could do surgery for this tumor that was obviously starting to bleed into the abdomen. And they could do surgery. Well, they couldn't even do the surgery till next week. And I went and did that euthanasia today, and we both were like, this dog probably wasn't even gonna make it till next week. I've seen that a few times where people have had to do an emergency euthanasia while they're waiting for their specialist appointment the following week. I'd love to see veterinarians do a better job at offering you everything, because they have to. It's important. They're liable to offer you everything, and you have a right to know all your options. And they need to warn you of things like your dog could crash before the surgery. The surgery may not work. You know, your cat may suffer on the journey to getting the weight off, and we may never even get to the point where we're controlling the pain. I'd like to see the whole picture, and I'd love to see euthanasia offered up as a valid and supported option at the vet clinic. I'd love to see, here's what we can do, here are your options, and if you choose not to do it, that's okay. Again, we're talking end of life. I'm not talking about animal neglect here, just to make that clear. I'd love to hear from you guys. This is a brand new channel for me. Obviously, I'm so sorry. The editing is just not what it's, I mean, hopefully I'll get better, right? They all say with time you get better. But I'd love to hear from you. Help me start this channel, grow this channel. Tell me what you want to hear from me in this area, and I'd be happy to make more videos for you.